SARS-CoV-2 is a virus that has become an international pandemic. While some countries have dealt with this pandemic in proactive ways, others have not been fully prepared and succumbed to its devastating effects. However, since this virus spreads over time, the global community has learned from other countries' own experiences as to what the best practices are in order to help prevent the spread and resulting death of SARS-CoV-2. After extensive research into SARS-CoV-2, using credible sources such as the Center for Disease Control and World Health Organization, WHO, this speech will explain in depth the initial outbreak, the spread and symptoms, why this is a global pandemic, and the information learned from other countries' experiences that have helped to prevent the further spread of this deadly virus. On December 31st, 2019, the WHO was informed of a new pneumonia-like virus that originated in Wuhan, China. This virus, now known as SARS-CoV-2, has spread around the world at an alarming rate. Symptoms include coughing, sneezing, and difficulty breathing, which can result in death. Most people experience symptoms within 1 to 14 days. However, symptoms vary from person to person. While many will experience symptoms of SARS-CoV-2, there is a large percent of the population that will become infected and show no signs or symptoms at all. They are known as asymptomatic carriers and spread the virus as they continue their daily lives, unknowingly infecting those around them. They also have the highest viral load, meaning they are highly contagious within the first few days of infection. Unlike other viruses, SARS-CoV-2 tends to have a higher rate of infection and is more contagious than most common viruses. The rate at which a virus spreads is known as the reproduction rate, or R0 rate. In the case of SARS-CoV-2, the R0 rate is 2 to 2.5, which means one person can infect up to 3 others on initial contact. According to Anjana Ahuja, a science writer for the Financial Times, the number of infections is thought to have doubled every 6 days. This rapid growth explains how the virus has become a pandemic. According to ABC News, as of April 22, 2020, there have been approximately 2,560,000 people infected worldwide, and 177,000 have died. During the initial stages of the outbreak, 5 million Wuhanese fled Wuhan and traveled internationally. These individuals could have unknowingly infected large groups of people as they were most likely asymptomatic. Almost immediately after this, Wuhan went into lockdown with an order of quarantine. This preventative measure has been common throughout the world. Spain and Italy's method of containment for SARS-CoV-2 was a nationwide lockdown, which drastically reduced the number of infections and the death rate. In Spain, after its lockdown on March 14th, the country experienced 3 days of consecutive drops in the overall death rate. In Italy, after 21 days, new cases of the virus dropped by almost 1,000. As mentioned, the practice of lockdown is highly effective. For these reasons, most countries around the world have initiated their own form of a lockdown. Conversely, New Zealand and Taiwan are 2 nations that were highly proactive in order to reduce the cases in their respective countries. New Zealand's response methods to the virus were border controls with immediate quarantine of all travelers, rapid detection of those infected, intensive hygiene promotion, and physical distancing. In Taiwan's case, their Center for Disease Control immediately ordered inspections for passengers from Wuhan and banned all incoming flights the same day the virus was first announced. Those from harshly affected areas were put under mandatory lockdown and were tracked via location sharing on their phones. As a result, Taiwan was able to keep its country's cases at a minimum. While New Zealand and Taiwan were highly proactive and prepared for the impending virus, other countries took a different approach. Sweden's strategy has been very different from other countries. According to Forbes, Swedish citizens have a large amount of trust in the government, and the government has a large amount of trust in its citizens. This, along with low projected deaths and initial pandemic models, explains why Sweden has relatively loose measures in place, such as no quarantine or lockdown, schools are still open, and not even an official requirement of social distancing is in place. This approach has been called the herd mentality. Unlike Sweden, the US is implementing rather normal means of like lockdown and social distancing. The widest known measure in America is social distancing, which is avoiding contact with others and staying 6 feet apart. Travel between countries has been banned, and each state has issued its own travel measures and guidelines. In conclusion, SARS-CoV-2 has spread quickly and has a global reach. It has passed from coughing, sneezing, and speaking, releasing droplets into the air. Asymptomatic people have also helped to spread this virus further. While we learn more about the virus as each day passes, we continue to learn the best practices and methods of prevention from many different countries. When this is all over, we will be able to look back at what measures were most effective and hopefully implement the best preventative action plan for the future.